first handed and I'm working on this shoulder, I don't mind if you start face to feet because you're not going to be coming across your body. That's irritating for me. And you're with this positioning depending on what shoulder you're working. Because if I was doing her left shoulder right now, I'm going to be face to feet to start. Okay, so my direction when she is in supine position, I'm going to be starting from that middle border of the collarbone. And I'm going to be working off the clavicle, pulling into the top of the breast tissue or the pec. As I'm working my way over to the side of her front delt, right in here, that's the meridian for our lungs, so we call it smoker's spot. And so this can be a pretty sensitive area for most people. And if people complain about getting numbness, tingling, burning sensation in their fingers, you got to focus on this area because that's where your brachial plexus is, and that's the cluster of nerves that comes all the way down and attaches to the fingers. So that, if it gets calcified and irritated, as I'm moving and pulling, and I'm kind of pulling on those nerve fibers, I'm going to feel that sensation come down to my hand. So this is going to be that focus point for people who have irritation in their hands. So after I've done that, I'm going to be carving my way over top of the acromion bone right here. This is where we worked to when we were doing the upper back and we stopped at the acromion bone in the shoulder girdle. Now I'm coming over top of the acromion bone and I'm going to be working, because it's a nice big muscle belly. And when you're doing it, depending on the size of the person, make sure as I place their arm, because we're going to have those 3 main arm positions when I do this position. It's going to be 90 degrees down. We're going to do it again straight out and then 90 degrees up. And what I just did, I don't want you to do. Just rotate it over because I'm actually hiding some of that tissue. I want you to pick it up, flatten the tissue, place it on you because it gives me more surface area to work. So just always kind of reposition that arm, do necessary. Do you have anything you'd like to say?
Yeah, I do.
Thank you, Dr. Wolf.
Okay. The other thing is I know he's going to get to it, but you're going to find that when somebody comes in, this is called the bicipital groove. This is your secret. Let's say if somebody says, I've got a frozen shoulder, and you're at the bar, or you're at someone's house. If you're at someone's house or you're at the bar and they say I have a frozen shoulder, I have something wrong with my shoulder, you know, you can go into their bicipital groove and only work on that for 2 minutes. And that's usually going to release it, eh? Yeah. So, and in here, that's where all the nerves come down in through this channel. But I just want to say something. So understand this. Let's get this. Okay. So a chiropractor can help to readjust and try to get the shoulder back into place. That's only if there's not too much scar tissue and loose. Adjust it and put, so if they toke too much, or if they drink too much alcohol, or if they get stressed out. Okay, because all of these create acidic conditions, which actually causes contraction in the body into a fight-fright response. So anytime you have contraction and you already, your tendons, your ligaments are a little bit shorter because of the dehydration, or there's a knot. You know, a person can actually have pain by having a little knot here, can have pain all the way down into their hands. If it's not looked after, they'll have pain coming down into their elbow, and then eventually it'll come down into their hands. Then they'll even get maybe carpal tunnel syndrome, or they'll get where their hands fall asleep all the time, or Raynaud's, or all of this happens. And understand, so now go ahead, go get acupuncture, but now you're just trying to move the energy around. Go get adjusted, and I'm not saying that anything's wrong, but if you get adjusted, you didn't get rid of the scar tissue, the calcification, the crystallization.
It's still going to have an easy time getting back out.
That's right. So go ahead and do massage, but we already know what that does. Not a lot. There's massage therapists here that know it doesn't do a lot. You can give some relief, but your hands can't feel anything. Your elbow can pick up on the smallest crystallization, smallest calcification. We can actually pick up on little fibroid tumors and cysts that doctors, they don't even get. They don't even pick that stuff up. And understand, I've got a guy that, he hasn't come down this year, but he comes down every year because he doesn't want to go. He's already had surgery twice for frozen shoulder. Now, he loves his Pepsi, he loves his beer, he loves all that. He's not going to quit. So he comes down and he gets like 2.5 hours work on the shoulder. Very painful, but he says, I don't care. I'll come down, I'll fly down every year because I'm not changing my lifestyle, right? So you need to understand something, that when you guys start this, Sage is gonna show you a technique. When you put a person on their side, and you've got them just putting their arm here, and you're coming down here with your elbow, that is the quickest technique to show people what it's really about. And understand something, everything we do, we are connected to our patient. We are not arm's length away, okay? The further you are away, the harder it's gonna, this is body work, for God's sakes. You wanna be connected to them, okay? And you wanna get in there and you really wanna work on this area. Listen, there is no work like this that I know. I've been doing it now for over 40 years, okay? We make big claims, not claims, but statements, because we've been doing it for so long. Understand, once
I
people...
claim that if you want your body back, you can take it back.
Yeah,
we
and
just have
understand.
some cool tools and tricks, and then I'm going to show you how to treat yourself right.
And understand something, we're talking that sometimes we might spend 20 minutes in here, okay? And we accomplish what somebody's had for 10 and 20 years. So, you know, enough of everybody out there. The majority, I don't really care what they have to say, because they all think the same and they're not thinking. And the reality is if you look at it, the work and the body work that everybody gets is the same body work that everybody gets that doesn't work. So let the world attack us, but I'm not going anywhere. Let the world attack us, but eventually the whole world's going to want to do this technique. They're going to want to get it, and the world's going to stop running away from pain. When you stop running away from pain and you come and see us, and we create a little bit of pain because we're pulling the scar tissue apart and we're releasing the nerves. You do know something? When a doctor says, well, the nerve is dead here, he doesn't know what he's talking about. When they say that you have stenosis in your spine and the nerve's dead, he doesn't know what he's talking about, or she doesn't. They don't know what they're talking about. It's wrapped with scar tissue and calcification. So understand something, only a few days ago I had the biggest attack from the government and the medical system and the media I've ever had, and the reality is if I was wrong, I'd be running scared. And the reality is just remember something, I will tell you, it's called self-care and self-love, and the day that I stop will be the day when the world is in big trouble, when I decide to give up. That means it's gone to hell in a basket. And I am never going to stop talking the way I talk, walk the way I walk, and teach the way I teach, because understand something, okay, all right, it's time that they don't put the diaper on our face anymore. Because I'm going to tell you something, there won't be tyrants when there are no more slaves or people that decide they want to be enslaved. And guess what? They're always going to allow the Swedish massage, and there's nothing wrong with it. That's the first thing I did. I went to school for that, okay? But the reality is that took 2 years, and Sage is going to unleash the thunder in 12 days.
So I've had 2 patients since I've been back with exactly what he's saying, a frozen shoulder, and you can feel it all in here. It's all right here. So when you feel that, I've had other shoulders, they haven't had that, but these 2 frozen, and I get like 70% after 1 treatment.
Yeah. And the more treatments you get, like the better it gets. Like at the beginning, that's when they take leaps and bounds and they're like, wow, this is really what I want. And then your body starts to slow down because you're getting to like the root cause of things. So that root cause of things has been there for how long? So it's gonna take a few treatments to get, like at the beginning, I might get 40 to 60% of relief. And then after that, I might get 15 to 20. And then after that, I might get 8%. And then it just slows down and slows down because your body is going to plateau everything. Like you can only get so big, you can only get so strong. But then we can always increase our like mentality and stuff. And there's always different things that I can build my strength in. But do the same exercise every single day for the rest of your life. You're going to plateau somewhere. And so you can only get so young depending on how old you are. But we want to try to grow young because our bodies are always constantly breaking down. So it's about being mindful of not allowing it to break down to that degree where I feel like I am slowing down. Because I will get older, but I don't know if I will slow down to the degree of where I won't be able to do the things that I ever wanted to do. Because limitations are only coming from here, and then we allow our body to limit us. Yeah. It's the lung meridian. The meridian for your lungs. And so, I'm going to kind of redo that. So we're going to start at that medial side of the clavicle. I'm going to work my way, and I'm starting at that medial border of the clavicle, and I'm keeping that skin taut. I did her chest the other day though, so I'm going to be mindful of that. Coming off that side of the clavicle, and I want you to tuck that elbow right under so I'm working kind of under that clavicle, come off of it, hanging right in that shoulder girdle area where we call that smoker's spot, top of the pec, coming over top of the acromion bone, and right now I'm going to be pulling towards me on an angle and up, so like face to face, face to side, and that's just going to be my windshield wiper. If I want to pivot my body a little bit more, I can just shift myself like so. So now I'm pulling more vertical. Like if I was noticing some irritation in my shoulder as I was trying to get that windshield wiper. But if you feel like you have a decent amount of range of motion here, you're good to go. And it doesn't matter if you strip it down the medial, then the middle, then the lateral, or if you shift side to side, covering it all. Kind of just go by what you're feeling and allow your elbow to talk to you. I'm definitely feeling more on that lateral side. As I'm opening the bicipital groove up though right here, because your bicipital groove, you're like wondering what it is, push off your bicep and then you'll feel your humerus. That's the bicipital groove. So like almost mid-arm area, right before the tricep. And I'm going to work my way to about 3/4 of the way down the shoulder. I'm going to stop like 2 inches